Welcome to the Media Advisory and live stream for this Friday, June the 12th, which looks like it's going to be a hopefully spectacular weekend, certainly a wonderful day today. Welcome to you all, and some announcements from the province. Starting June the 18th, residents in long-term care homes that do not have COVID-19 outbreaks will be allowed to have outdoor visits of one person per week. Retirement homes can allow indoor and outdoor visits, with the number of visits allowed being left up to the discretion of each home. Visitors to both types of facilities must also have tested negative for COVID-19 in the previous 2 weeks. The province also lifted the recommended 30-day supply limit on prescriptions beginning June the 15th. The Ontario drug benefit recipients can return to filling up their 100-day supply at a time from their pharmacy or dispensing physician when appropriate. The province will continue to monitor this situation to ensure there are no disruptions to the drug supply chain in the future. And with the supply of medication stabilizing, people can safely go back to getting their regular prescriptions filled. I'm sure this will be a much desirable convenience, especially for seniors and vulnerable citizens in our community. Yesterday, the federal government announced a $57 million investment in Canada and Ontario's small businesses through 3 programs. One of them is the Shop Here, powered by Google program, which will leverage Ontario's strength by hiring skilled and trained students to build and support the launch of online stores for businesses that previously did not have the capacity to do so themselves. So the core goal will be to help small businesses compete and grow in a world that is increasingly online. Secondly, the Digital Main Street Grant. This grant will help Main Street businesses be digitally more effective through a $2,500 grant administered by the Ontario BIA Association, Business Improvement Areas Association. Small businesses will be able to adopt new technologies and embrace digital marketing. So municipalities, chambers of commerce, and business improvement areas can apply for a Digital Service Squad grant, which will allow them to establish teams to provide personalized one-on-one support. And the third one is the future proofing of Main Street. This will provide specialized, in-depth digital transformation services and support that helps existing Main Street firms adapt to changes in their sector and thrive in this new economy. By leveraging teams of digital marketing professionals and talented students, these firms will be able to create new online business models, develop and implement digital and e-commerce marketing strategies, and maximize digital tools, platforms, and content. There is now a deeper pool of funds available for small businesses to go digital and receive the administrative supports to take great steps in that direction. This will see the City of Hamilton's Business Center and Innovation Factory work together to deliver programming, and a number of grants and total funding envelope for Hamilton will be shared with the municipality in the coming days. So in the meantime, for more information on all of those, go to digitalmainstreet.hamiltonbusinesscenter.ca. Let me try that again. digitalmainstreet.hamiltonbusinesscenter.ca. All of that information is there for businesses that want to tap into those 3 new tools funded by the province of Ontario. Very helpful. And some Hamilton Public Library locations will begin offering curbside pickup of on-hold items beginning on June the 23rd. It's vital to keep reading, watching, and learning while maintaining our community's health and safety, and I know that many people are. Libraries are now slowly starting to reopen, starting with this curbside pickup of on-hold books, music, and movies. You do need your library card to pick these items up, and all locations will eventually be open for this type of service when enhanced cleaning and other safety protocols are in place. So that's certainly something to look forward to in all of our libraries throughout the city. The library will provide additional information about their phased reopening plan in the coming weeks, and we'll continue to work with the City of Hamilton and Public Health to that end. So you can also visit HPL, hamiltonpubliclibrary.ca, for more information on that. I'm going to turn it over to Paul Johnson, our Emergency Operations Center, who has and continues to do a fantastic job of keeping us informed and safe. Paul?
Thanks very much, Mr. Mayor. I just wanted to follow up on a few things that we've talked about in the past and are starting to move forward. The first is around childcare. So as you know, earlier this week, the province indicated that childcare centers could open as early as today if it was safe to do so. They later on that day, on Tuesday, provided some guidelines, and we have worked with our public health unit, Dr. Richardson and her team, to develop a Hamilton approach to how those guidelines will be implemented and how we will safely open our childcare centers in this community. I want to pass on my thanks to all of the public health staff and our children's services staff who have been working together before the announcement on Tuesday and have been working this week to get ourselves prepared. We made public to the community the guidelines so that all parents and caregivers understand the guidelines that will be followed within the childcare centers and can be aware, so that if they have any concerns or questions, they're as much informed as we are, as well as the childcare providers themselves. As part of our reopening, there'll be an awful lot of communication with our operators. We have a number of operators, close to 100 in this community, and they will be working with our staff and public health staff. There is a comprehensive training program that needs to be delivered to all childcare staff so that they are aware of these new safety protocols. And for families, unfortunately, it will not be full childcare centers at the same level as they were pre-COVID. The numbers will be greatly reduced in order to ensure the safety of the children and the staff, and obviously the parents and caregivers who are coming to drop off and pick up their children. One of the requirements will be a public health inspection of all of the centers, ensuring that we are able to satisfy ourselves as a city that these centers are ready to go and offer safe service. This is a great step forward for many families who have struggled with childcare, and as more and more businesses begin to reopen. And so we know it's critically important to the economy that childcare is here. We just want to make sure over the next week or so that as we start this process, it's done in a very safe way. We talked lots about HSR moving to mandatory masking on June the 22nd. And again, we do recognize that for some, wearing a mask is not possible. There are some for whom the recommendation is not to wear a mask, and that includes young children under the age of 2 and anyone who cannot remove their mask. But there may also be other underlying medical conditions that make it impossible for people to wear masks. So we do understand that, but we're asking everyone who is able to wear a mask to begin wearing a mask on transit on June the 22nd. Furthermore, for those who are City Hall watchers, you will know that in terms of moving back towards fare collection, there are reports coming forward about how HSR will do that. And we are targeting loosely July the 1st as the date where we will start collecting fares on HSR. There will be more information coming next week about all of the things that will lead up to that and how people can become prepared for that. But we did today want to let people know that we are very much working towards a July 1st date to return to fare collection on HSR. There has been a number of questions in the community about summer camps, and I just want to reiterate that the province of Ontario did say that summer camps, as long as they follow strict public health guidelines, can reopen in stage 2. You will recall that Hamilton is still in stage 1. So there are parts of the province that moved into stage 2, but Hamilton remains in stage 1. But summer camp, day camp programs that want to start to get ready can certainly start to prepare. And once Hamilton moves into stage 2, if it's feasible for those summer camps to move forward, there'll be some guidance from public health about how to do that. And it's also a reminder that for the city of Hamilton, we are looking at a modified approach to summer activities that does not include our traditional SUPI program and our Camp Kadaka program for the summer of 2020, but we will be providing, assuming it is safe to do so, and we'll give more information about when we can do that, some additional activities actually physically in locations within the community and parks, and we'll move forward with that. So lots of anticipation about when Hamilton might move into that stage 2. And of course, it's all predicated on the cases that we see in this community and how this virus is impacting Hamiltonians. And it's a good segue over to some new information and ways of putting together our COVID-19 picture for the city of Hamilton. I know Dr. Richardson has some news to share today. So over to you, Dr. Richardson.
Thanks very much, Paul. Hi, everybody. So the news on cases today, I've got a few things to go over. We're standing at 755 cases in Hamilton as of 9 o'clock this morning, and we've been averaging over about 4 to 5 cases per day for the last week. 79% of our cases are resolved, which is good news. So they are at a point where we don't believe them to be infectious. They may be completely resolved. Some people do have some lingering symptoms we're seeing, but once they've really substantively improved, we don't consider them to continue to be infectious. We have had 42 deaths, unfortunately, to date, as we've talked about, and there are no new deaths today. And we are at 0 institutional, 0 community outbreaks, which is a fantastic day to have. It's great news. It's the first time since March 19th that we have had no institutional outbreaks whatsoever, or community outbreaks. So that is very, very good news. And more details about that are on our website. So, we're talking about the trends for reopening. And this is where the piece about it all being in our hands is so very true as we move forward. We have done a great job as a community. I know we weren't in that very first wave of reopening, just as 80% of the population here in Ontario wasn't. And that's because we are a larger municipality. We're a little more, lived a little bit more closely together. And unfortunately, we have seen some significant outbreaks, and we've had some increasing trends, as we talked about in the 20-something-year-old age group over the last few weeks. But that has definitely come back down. So we want to see that continue, people continuing to do the hand washing, the physical distancing, the staying home if you're sick, being mindful if you're living in a setting with a number of other people, that is where those things can happen as well. We tend to see transmission mostly happen either in an outbreak, as we saw with some of the retirement homes and long-term care homes, or in a setting where people are living together. This virus particularly loves to be transmitted where there is more prolonged, close contact. So families, we do tend to see a transmission in the family. It's harder to stop in that setting, but also in a setting with roommates. And so those sorts of situations where you may have 5, 6, 7 more people living together in a house are a setting where that happens too. But we need to think about it, whether we're commuting in the car as we get back to more normal work. And our public works folks are particularly experiencing this, where you need to think about physical distancing in the car and how might that work. So it really is in our hands as we move forward, and we want to see those numbers stay low. And if that's the case, then it does bode well for reopening our community, but it also bodes well for reopening our services too within the health system. So keeping in mind that those things are all interrelated. Some other news we've been working on restaurant guidelines for reopening, knowing that, we're not quite there yet, but we will be there soon, as long as nothing changes. And so we wanted to get some guidance out there. So we have developed those for restaurants, food establishments, and suggesting that when you see these up on the web in the next day or two, to have a look at them, look at what's required, think about what you need to do as we go forward, even as we're still under the order from the Emergency Management and Civil Protection Act. We can start to prepare for where we need to be. So it's available on the website in the next couple of days. It's broken out in 2 parts. The first part gives advice on preparing for food services safely, and the second is modifications needed to the premises and practices. So just more about the physical plant and what we do while we're working, or when the customers are in that sort of setting. So it's very much there for people as well that may be doing takeout right now and or delivery, and are moving into dining outside, or those sorts of things too. So key things: keeping staff and customers 6 feet apart, as we always talk about, recommending that staff and customers wear a mask except when eating, because again, it's a setting where people would be closer together, would be within that 6 foot for a period of time while they're there. Making sure that there's screening signs, and staying home when either staff or visitors, customers of the restaurant are sick. We do ask that people maintain a check-in log of staff and customers. That's in case there are cases related to the restaurant, so that we can do that contact tracing very quickly. You've heard from us how important the case identification, so people going to get a test done within 24 hours of onset of symptoms. But then for us as well, when we're tracking down contacts, we'd like to contact them and make sure that they get isolated, look and see if they have symptoms, get them tested within 24 hours as well. So we're asking that those be tracked, so we know for anybody who's a close contact how to follow them up. Then again, when we're talking about surfaces, we know they don't play a huge role in transmission, but they do play a role in transmitting this virus. So enhanced cleaning, disinfecting of any contact surfaces, and of course, washing our hands frequently. Another piece today, we've talked about it a little bit over the last couple of weeks. We've had a lot of inquiries around information around the location of COVID cases in the city of Hamilton. And while we definitely don't release information on specific cases or specific addresses, we have now, with our epidemiology and evaluation team and the city's GIS section, put together an interactive online mapping tool that you can look at. So it was launched on our website just a few short minutes ago, and can be found at www.hamilton.ca/coronavirus under the section on status of cases in Hamilton. So it was created to assist people who are interested to look at the location of confirmed positive and probable cases by neighborhood. So I'm going to show you that right now. I'm going to launch the tool. I'm going to share it with you all. I just have to make my screen a little bigger here. There we go. You'll see it in a moment. Here we go. So you should be able to see this now. I'm going to turn the legend off for a moment. And I'm going to try and tuck our video screen out of the way. So you'll see this map of Hamilton overall with the various colors, and the darker blue that you have, the more cases there are. So going from a very light beige through to a darker blue. It's tricky to find the legend sometimes in these products, but it's just up here at the 3 bars. So if you click on that, you'll see that the shading indicates the varied number of rate of cases. So we've talked a lot about counts of cases, but it is important to look at rates because that gives you an idea for comparisons just how high or low the number of cases may be. When we look at the map, you can, I'll just go get away from the legend for a minute. I use a tablet in my work, so I'm in a mobile type view. If you were on a computer, a desktop computer, or a regular laptop, when you click on one of these census tracts, you will see a little pop-up box come up. But on a tablet or a mobile device, it looks a little bit more like this, and you click on the arrow, and you'll get the rate per 100,000 of that particular census tract, so 52.2, how many confirmed or probable cases have happened there, and what the total population is for that particular census tract. So as you look and see these different areas, you can see that the rates do fluctuate across the city. There are some areas with higher rates than others. When we look at these things, we have mapped every single case. So one thing to keep in mind is that if there's an outbreak that has happened in a long-term care home or retirement home, that for the people who live there, that is considered their home. And so a number can be elevated because there is a particular home in that area. The other thing to keep in mind, I'll just zoom in a little bit further. Oh, that's a lot further, is that just because there is, that's where the cases live, that doesn't mean that's where they acquired the virus. So if you think of the fact that we have had cases in long-term care home workers or healthcare workers, they would be mapped by the place that they live as opposed to the place where we think they may have gotten the virus. So it's very difficult for us to ascertain for each individual person. It's basically impossible for us to ascertain where they may have gotten the virus from. But just to keep that in mind, that just because a rate is higher, it may not be that that it was that people actually got their virus in that area, but it is where people live. So that is our tool. I'm going to stop sharing it now. Got to look at which way to do it on this particular software. There we go. And just going back to look at those things, you just again saying you can get the reference name of the census tract if you're on the desktop or laptop application. You can get the rate for it. You can get the total number of cases and the total population. So when you look at the map, and you can see there aren't any particular hotspots or clusters in the city, and from a geographic perspective, we do the analysis and look at other dimensions of this. And so, you know, you've heard in the paper over the last little while discussion about outbreaks, and that's one way that cases cluster when they're related to a particular place. You also see that there are increased rates in healthcare workers because they are the people intimately working for and caring for people, and so at higher risk of transmission. As well, you've heard us talk about the clustering by that age group demographic, where we're seeing, you know, groups of people who aren't, based on our interviews with them, taking all of the measures that need to be taken, but also that they're living together in these closer groups with roommates. And so that's mainly the way we're seeing clustering in the city at present. So just again, a big thanks to the teams from GIS and from our Epi and Eval team who pulled it together and made it available for public use. So that's about it, I think, today for me, Mr. Mayor. Longer than I usually go on. I'll hand it back to you.
Thank you very much. And right back to you, actually. So I'm asking on behalf of my barber, who keeps texting me and calling me, asking me if it's time, and I say no, not yet. But is there information on the website for nail salons, barber shops, hairdressers, in terms of them making some preparations to get ready for a potential opening soonish?
So our website does link through to the provincial website. So the province has done a lot of work in looking at different types of setting. I think at last count was something like 63 or 68 sets of guidelines that were specific to certain types of premises. And so the best place to start out is there and look at those. There's it goes through, it's pretty consistent guidance across many of them that talks about the things we've all talked about distancing, hand washing, all those sorts of things. If people go through that guidance and still, have specific questions that need to be asked, they're welcome to call our IPAC team, our Infection Prevention and Control team at Public Health Services, and they will get back to you quickly. I'll just say I'm really proud of that team too. We have 17 inspectors that have come from across a number of programs for this next week to look at and concentrate on childcare opening, so we can get those going as fast as the operators are able to do it. So they're there too to answer other questions people have, and they've just been a great team in this response. Lachman Nandu and his group have been fantastic,
Great.
along with
Thank
all
you.
my colleagues.
Yeah, we are much appreciated, and I'll let Mario know. So beyond that, I will remind everyone that a lot of people are doing some great work in our community, a lot of caring and sharing going on just about everywhere. And I try to reflect on that every time we get together, whether it's in the food banks or in housing or looking after the homeless or, looking after neighbors and friends. There's just so much good positive work going on, including, help and assistance for our frontline healthcare workers. So I want to do a special shout out to the Kiwanis Club of Hamilton. They've donated 500 protective masks to the Boys and Girls Club of Hamilton, and an additional 500 to the Salvation Army of Hamilton and area. So 1,000 masks, I'm sure, are very, very worthwhile, and very important that this organization's made that available to our frontline healthcare workers and to the Kiwanis Club. So thank you for that. The other acknowledgement I want to share, and if you want to acknowledge or want me to acknowledge some of the good work that's out there, please send me your information at mayor@hamilton.ca. I'd be happy to hear about the great work that you're doing and sharing that with the community at large. But a shout out right now to Linda Schustra of St. Joseph's Healthcare in Hamilton. Linda is a nurse who designed a homemade protective hood to be worn by her colleagues at St. Joe's. When supplies of the personal protective equipment were running low at St. Joe's, Linda leapt into action. She is a quilter in her spare time and made the template for the hood from some pumpkin print fabric that she had in her sewing room. So along with some family members, Linda sewed an initial 300 of these hoods, and she has now organized a small army of community volunteers who are sewing the hood by the thousands. And the hoods are sterilized at the hospital and used by nurses and staff to protect them from transmission of the virus. They are deemed to be so useful that this template has now been shared with other area hospitals. And so well done, Linda Schustra, and all of your volunteers for this ingenuity and good work and help and assistance to our frontline workers. Thank you. And again, just repeat, frontline and essential workers, in case you forget, thank your nurses, thank the nursing home staff, thank the cleaners out there that are keeping all of our spaces and places clean, whether it's institutional or in nursing homes or in the hospitals. Grocery store workers, the checkout clerks, each and every day are out there making sure that we're getting the supplies we need with some risk. And the truckers that are delivering that all over the country, everyone that's going above and beyond to keep our city functioning and hopefully ready to proceed to next steps. And very encouraging news from Dr. Elizabeth in terms of our cases. And so it's not time to throw everything away and go back to whatever we had before, but it's certainly looking better. And I think you can feel the mood in the community starting to shift. And I think that's what we all would like to see. And so hopefully everyone can have a good weekend with 10 or less. So I imagine there are going to be some reunions or folks stepping into a bubble that may not have seen each other for quite some time doing the right thing. Manage to continue to do the right thing, but also manage to enjoy yourselves and this beautiful weather that we're having right now and whatever space that you can enjoy. I'm going to turn it over to Jasmine for some media questions, and then we'll wrap it up. Thank you. Jasmine?
Thank you, Mr. Mayor. We do have 4 media on the phone today. We'll start with Dan Takama from CBC Hamilton. Dan, you can go ahead.
Hey, good afternoon, everybody. My question is probably best for Dr. Richardson. You touched on this a little bit already, and obviously the map is good for people who are curious about where cases are. But for you and your work, can you talk to me about how it's useful to you and if it informs your work, if there's any sort of takeaways at this point?
Thanks, Dan, very much. In terms of the map, this is a piece of the who, what, when, where that we do in epidemiology, trying to understand the patterns of disease that happen, and that helps us to also understand what might be happening behind it. So transmission, risk, those sorts of things. And so when we look at things by age, when we look at things by work site, when we look at things by type of work, when we look at all the different dimensions that play into this, we get a lot of information from looking at it, and graphing it or mapping it, I should say, is looking at it in this way is one of the things that we do. So again, it allows us to look at our parts of the city very different than other parts of the city. And one of the things that we do look at as well is how does that relate to other factors? And so we know from a health equity standpoint that in the bigger picture in the United States, in Ontario, we do see a differentiation in terms of people from lower income groups, from racial minority groups being overrepresented in the COVID data. And so we are, as you know, we started collecting information on that a couple of weeks ago. And as our case numbers get lower, it gets harder to understand trends, but we are still gathering the data over time to look at that. We know from mapping it this way, we can map it in comparison to income. We don't see a strong correlation when we look at it on a mapped basis. So that takes sort of broad information. And then the data that we're collecting case by case will give us the specific information about cases and their income level. And so we're very happy to say that many people are giving us that information. We know it's a sensitive topic, and people want to make sure that information is used well, and we're very much committed to doing that. But we've looked at it this way from a mapping perspective, and then we'll get further data that gives us on a very specific case by case basis what those correlations are.
Great, okay. And you've segued really well into the follow-up, which is just along the same lines there, talking about race-based and socioeconomic. Is there a risk here that we're starting to collect that information too late, and that as the cases dip, you won't be able to kind of gain the insight you would have been if we did this from the beginning? Is there any kind of concern there?
So for us here in Hamilton, we're part of a bigger picture, of course, in terms of what's going on. And so we are glad to have started collecting the data now. We just could not get there earlier, and we didn't want to end up doing things twice. It's been, we have more than 50% of our staff redeployed doing this work, and we've had to make some very conscious decisions about what to move forward with and what to work with the province on when we know that they're working on something. So they have been working on things. My understanding is they are planning to make some changes and start that data collection across the province. But we did decide that, we needed to move forward before that. I think, as we go forward with COVID-19, my dream would be that we eliminate it. I think we've seen some information out of New Zealand and others where they've managed to reduce transmission entirely. And so we would love to get to that place, and that would be the best case for everybody. It's not likely to come quickly, and we've certainly gathered a fair bit of data already to be able to inform us. And as we look at preliminary information, which it's too soon to really draw any conclusions from, it does show us that even with the small number of cases that we are continuing to have, we do think we'll be able to look at that, look at how it compares to other jurisdictions, and draw some good conclusions from. And of course, at some point, we'll have to decide whether it's worth going back to the people who have been ill and ask them for information as well. For now, we're moving forward. Once we see the changes that the province makes, we will look at it in other ways. We've also been very glad to have some offers from McMaster for some support in looking at how the data is utilized. And the province, as well as we understand, is going to look to broadening up collecting of that data voluntarily, of course, for diseases other than COVID-19 too, which is good news because it lets us look at those trends in other diseases besides COVID-19, where we very much think it plays out our sociodemographics, our income, all those things play out not just for COVID-19.
Thanks, Dr. Richardson. Next question to Joanna from the Hamilton Spectator. Joanna, you can go ahead.
Hi, thanks so much for taking my question today. I'm looking to find out, Dr. Richardson, if you expect us to move out of phase 2 next week. Like, will we get good news on Monday? Is it looking good for us right now? Like, what do you think we'll see on Monday when they reevaluate?
So there is a bit of reading the tea leaves, right, in terms of where we're going, because we know that we're going to be looking at the whole week's worth of data before we get there on Monday. So we've got a few days yet to go. We're hoping, fingers crossed, Hamilton has done a great job in terms of controlling the spread of disease. We're at 0 outbreaks. Like, these are all positive signs with only 4 or 5 new cases per day. We're at a point where we can really understand the transmission and what's happening. And so all very positive signs. So I'm hopeful we'll be able to move there. It depends on how the next few days go, and then discussions further at the provincial level as well.
Thanks so much. And for my next question, Dr. Richardson, today the province increased your social circle. So the 10 people you can actually have physical interaction with, or the 9 people, I guess, including yourself. What is your advice to people? Like, I feel this might be a bit confusing for people or difficult to understand. What is your advice to people as they are trying to determine the best way to do this?
Yeah, Joanna, it is a bit confusing, isn't it? When you look at it and the guidance around what we call these bubbles, right? And so this is the group of people with whom you're going to let the guard down, go back to giving people hugs, go back to that closer interaction that we would all love to have. We know how important that is to people's well-being, how important it is to our mental health. And so it is really great. And so when we're thinking about that, though, we really need to think about a stable social bubble. And so it's not changing that bubble every day or making sure there's just one bubble at a time. What we're trying to do is really continue to limit transmission while, respecting the fact that we're human and we have other needs and things that help to keep us well. And so we're looking at 10 people who over time would stay stable. If you have a large family or a small family, those family members get included in that bubble. And then you add additional people to it, close friends, you would add caregivers would be counted in that bubble too, till you get to that max of 10. And then those would be the people where you could let the guard down a little bit in terms of, as I said, doing things like, hugging, pats on the back, that kind of stuff that you might normally do with that group of friends. Hand washing, those things are really important still as we go forward. And it's not to be confused with the piece about 10 people when you're out and about. So if you're out and have a social gathering, that's still meant to be limited to 10 people, and you're meant to limit the physical distancing so that people aren't coming closer when they're out and about in that way. But the other thing to think about when you're thinking about this group is it's really important for us from the standpoint of contact tracing, and it really needs to be an agreement amongst that group. And so what you decide to do and who's in that group will vary. So for somebody who doesn't have people who are medically more fragile or people who are older, they may decide that it's fine to go forward with that group of 10. For other people for whom they're caring for grandparents or parents who are older or somebody who has severe illness, they may decide it's not the right time for them to enter into that sort of arrangement. So everybody really, it needs to be a consensual thing that happens amongst that group of people. And then we do use that information. If one person was to become a case, they still would need to isolate right away and do all the things that we've been recommending. But it also gives us information for us to do the contact tracing. So it's a way of balancing, limiting the transmission, doing quick follow-up if somebody was to get sick, but while recognizing the important things that we all need as human beings in our lives. So it's a good step forward, and one it's going to take us some time to learn and understand, I think.
Thanks, Dr. Richardson. Next question will be from Matthew from the Hamilton Spectator. Matthew, you can go ahead.
Hello, everybody. Mr. Mayor, I think this question is for you. Some of the agendas for next week have gone up, and there's some pretty grim looking pandemic-related deficit predictions coming from finance staff, depending on how we do with the lockdown, or I guess whether we return to it. Have we had any luck with our requests for help from the federal government, or are we now seriously looking at things like tax cuts or tax hikes or service cuts going forward?
Well, thank you, Matthew. And this has been an ongoing dialogue. In fact, just today we met with Rod Phillips, Minister of Finance for the province of Ontario, and Steve Clark, the Minister of Municipal Affairs in the province of Ontario, on that very topic, encouraging them to, and they acknowledge that there's an ongoing dialogue going between the federal and provincial governments. And I'm going to speak for Ontario and the federal government, that there's that dialogue going on, talking about, what kind of assistance and aids the municipalities are going to need going forward. We've made the case innumerable times with the through big city mayors, both federally and now provincially through Marco and the Ontario big city mayors, a new moniker for what used to be Marco. I think the message is getting through. So I remain optimistic that the province is going to, federal government and the province is going to come through for us with assistance. They know that the numbers that are being thrown around. Hamilton, I think the updated number is in the $50 million range if you project it out, and it goes even higher depending on how long this goes. They know that our transit systems are challenged, and lost revenues have been very, very difficult, even more difficult for larger municipalities with higher order transit systems in place and/or high volume transit systems like Hamilton, Toronto, Mississauga. And so they're well aware, and all the mayors in Ontario have been meeting quite regularly with all the appropriate parties. And so I'm optimistic. Now, having said that, do we have to kind of listen to our financial guru, Mike Zagaric, who does indicate that for this year, we're not in a critical state. The bigger challenge comes for our budget next year. That's when all of this hits. So, and we're asking both of our federal provincial partners to help us as soon as they can, with as much as they can to help offload the lost revenue and additional costs that we've come to bear.
Okay, and forgive me if I've already missed an update on this, and I don't know if this is a question for Paul or the mayor or anyone else, but as people prepare perhaps to reopen restaurants, if we get some good news going forward, have we had a lot of applications to close roads for patio districts and things like that? I mean, do we expect to have road closures on King William or Augusta or James Street?
I don't know about active applications. I haven't checked on that. I'll have to check with Jason Thorne. I know there was a lot of enthusiasm for this, and I've fielded calls from mall operators and mall owners and others that have restaurants in them that are all looking for, a quick and easy process to expand that we've allowed for, in fact. So I don't know what the numbers are. Paul, you might have some additional information if there's been additional uptake on that. I imagine that some of that might come to planning committee that is going to start meeting pretty soon. So, Paul, do you have any additional information on that?
No, Mr. Mayor, we don't have any. I don't have any numbers in terms of the applications that are there, but so we'd have to check in and get back to you on that.
Yeah.
If
So I'll forward that on to Jason Thorne, and he can. I'm sure he can share any additional information that he might have.
Thank you.
You're welcome.
Next question will go to Fallon Hewitt from the Hamilton Spectator. You can go ahead.
Hi, thanks for taking my questions. I have 2 questions on daycares. So how long do you expect the inspections to take, and when can we start to see them reopen in Hamilton?
So there's a series of guidance that has gone out from the Ministry of Education has provided guidelines in terms of what's to happen. We've also required an inspection and given guidance for daycare centers. We're going to be holding a couple of webinars at the beginning of next week for them to go through and explain what it is that is expected. And then we have, as I said, our 17 public health inspectors are ready and that are dedicated to this are ready to go. So it really is going to be up to the daycare operators in terms of their readiness. They need to make sure they have worked through and address the issues. We have staff that are going to be there to work with them as soon as they're ready to go. So that really will be up to the daycare center operators. We have heard from some of them that because of needing to meet those and get themselves back up and running, they're looking at more like end of June, early July, but we'll be there to work with them as soon as they're able.
Great. And my follow-up was, so what do you mean by like a Hamilton approach to guidelines? Is there anything Hamilton specific in the requirements like that differ from the province?
You mean around daycares in particular?
Yeah.
No. So what we generally do in these situations is we take the guidance that the province has put together, and if there's other specific information that we know from talking to the operators that they're looking for, that they haven't been able to find in the guidelines, there are frequent questions that we get, or things that are specific to this area about people who can help them out. That's the kind of things that go into it. So it's not meant to be any more restrictive than other areas. We are requiring an inspection just because with our experience over time, when it comes to any of these settings where a lot of people come together, we do find that's the best way to go through and make sure that people understand and are following the guidance that is out there. And so we are requiring the inspection, but otherwise we're just, working to help people understand what it is they need to do.
Thank you.
Thanks, Dr. Richardson. One question left from Joey Coleman from the Public Record, and I will read it. Paul, I think this question is for you. Will the city be repealing its physical distancing bylaw now that the province has issued social circles?
So it's a great question, and certainly the approach to it changes. We'll follow that, but as Dr. Richardson said, this is not an elimination of physical distancing. So I think a full removal of that bylaw is not something that came up today, although we'll do some more review of this next week. So there are certain circumstances where this may still be a useful tool for us, but people should not be afraid that we're going to layer on. The province has been very, very clear in terms of what people can do, and we will follow that guidance. But there are cases where it is not the time to cut back on that physical distancing, and this becomes a helpful tool for us locally to keep people safe. I will say also, as a bylaw and as a fine that we can levy, since this came into place, and I think it was April 9th that this bylaw was approved by council, we've only handed out 26 tickets around this. So this has not been something that's been used very often, and it is used often in cases where people have just decided that they are not going to listen to any type of reasonable advice about how close they should be together, and it becomes a useful tool. So to the public today, do not worry. We're very aware today of what the province has said, and we'll respect that. But in terms of keeping it as a tool where we still should be requiring physical distancing, I think it's another helpful piece that we have, but it's rarely used, and that's probably the best way to keep it.
Great, thank you, Paul. With that, Mr. Mayor, that's the end of our media questions. I'll pass it back to you for some closing remarks.
Thank you. And just as an update to what was just talked about, I know that the bylaw is coming back to GIC to be updated, not repealed, but updated, because it's currently locked into 5 or less. And it's going to be adjusted to reflect on whatever the provincial standard is at the time. And so it's not going to be repealed, but certainly going to be reflective, because if we were to leave this in place right now, the way it's written, it would still be enforcing 5 or less when, in fact, the province has determined that 10 or less is the current standard. So it's going to reflect the current standard, whatever that is, and the bylaw will be adjusted accordingly. Thank you all for your participation. Thank you to media for continuing to share information with our broader community. Thanks everyone for tuning in, for those that have. And a special thanks to Rosalie Visers and Georgia Whalen for their sign language interpretation, much appreciated. And Cable 14, Bill Custer's entire team, who I'm sure could do this broadcast on their own because they've heard it so many times. Thank you for keeping it a smooth operation here, and McLean Media for helping us ensure that it is a smooth operation as well. The lights just went off behind me, which I hopefully isn't a sign. But the weather looks absolutely fantastic. Hamilton has done, and I think I want to reiterate what Dr. Richardson said a little earlier, has done a terrific job of getting us to this point. So please do continue to adhere to some of the requirements that are out there, but at the same time, enjoy yourselves, enjoy the outdoors, enjoy the gathering of 10 or less. And I do sense a kind of renewed optimism as a result of that. And I do hope that we're not too far off from getting to phase 2 as other communities have done already. Thank you all, and have a wonderful weekend.